Some health matters now, and it's a sigh of relief for HIV patients globally after the technological innovation of a new class of anti-HIV medicines with long-acting effects, allowing people at risk of HIV infections and those living with the virus to take medicine twice a year. This was disclosed by the National Syndemic Disease Control CEO, Dr. Ruth Masha, during the 55th Program Coordinating Board for the United Nations on HIV and AIDS, UNAIDS, saying the medicine will be injectable.
In Kenya, approximately 1.3 million people are currently living with HIV and AIDS, with 1.2 million on antiretroviral drugs. In 2023, the country recorded 16,000 new infections and 1.3 million new infections were recorded globally. In a bid to interrupt the continuing AIDS pandemic, scientists have brought to the fore a new class of anti-HIV medicine with long-acting effects, allowing people at risk of HIV infections and those living with the virus to be injected just twice a year.
Adherence has been one of the challenges we face because it's really, especially for adolescents, very cumbersome to take a daily pill. Issues of stigma and discrimination, where children also are living with HIV sometimes stigmatized by their peers. So we are looking forward to really having an option for people to have that, for the prevention, having that twice dosage of injection per year.
Studies have shown these medicines to be more effective than oral medicine. However, the greatest challenge is the cost of the medicines.
More than 200 countries coming together and also being able to galvanize their voices to demand for price reduction.
New innovations, right? They need to be purchased. There needs to be a good price for people to buy them when we all get to that point. But we also need the community structures to actually convince people that they're, or educate people about them so that they're willing to use them, right? All of these are costs and these are programs that we need to sustain in the long term.
With developing partners withdrawing their donations, Ruth says the government is seeking to mobilize funds under the new health reforms.
So globally, 70% of the AIDS response is paid by countries themselves. But what it needs is a plan. It needs a real plan to think about how do you transition from donor dependency to actually paying for your own health programs in every country.
Within the social health authority umbrella, how do we ensure that the back end of commodity supply is available within that model that we have put in place?
Masha, Prime Edition.